Good morning. We'll start with the flag salute.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone, and welcome to the Shawnee County Board County Commissioners Work Session. Today we have two annual reports. One is from Vallejo Behavioral Health, and Bill Persinger will be leading us through that. And then we have Family Service and Guidance Center, and Kathy Mosier, you'll be emceeing that one. So without any further ado, we'll have Bill start out. Thank you.
Thank you, Commissioner.
Like a lot of places, we're converting our computer systems, and so I have a little minor correction or addition to the report. And I'll leave one here. And I have some. Mr. Crowhide, sir. Very good, thank you. I'll let you pass those down, please. Thank you, Ken. And I have extras for the media, the press if need be. My name is Bill Persinger, Chief Executive Officer of Vallejo Behavioral Health Care. Pleasure to be here. We submitted as much annual information as we could late last year, Commissioners, and then we were able to get some more data for the fourth quarter. We were able to extract some data from our computers as we were transitioning our client data and stuff over to a new piece of software. So we've got kind of an unofficial report just as recent as we could last year, and wanted to make this one just for the record. We are required to make an annual report to the county, although even if we weren't required, our history, we like to come in here and report on what we're doing. I'm probably only going to take 5 or 10 minutes, but of course my time is yours if you have questions, and I would cede the rest of our time to Kathy. She's coming in on her first year here, I think. And I know she's got a lot of things to report to you, and so I'll cede some time. I just want to point out just the basic elements of the report here. We're trying to cover the financial piece for you, the partnerships that we have. We have a list on page 2 of the services we provide. We expand on our partnerships a little bit on page 3 and 4, and then we have some outcomes data for you toward the end. That's kind of the gist of the report that I'll run through here today. We did end up with at a calendar budget 22 approved at $23,936,960. About 38% represented revenue for operations, grants, fee for service. Grants and contracts represented 62%. Personnel expenses were 75% of that, and then we had slowed down our fundraising the last 3 years due to the COVID. Raised $64,000 and some change last year, but that was without an annual event. We do have a fundraiser coming up on May 5. It's an hour. It's a breakfast, and I think probably you've received an invitation to that just over here at the Beacon. So in and out, I think with travel time and everything, probably take up about an hour and a half of your day, but it's going to be our first opportunity to try a breakfast fundraiser. And we have our big annual gala coming up in November. At your leisure, I'll just ask you to read about the partnerships we have. You've heard me say many, many times, we cannot do this alone. Literally could not do this alone. We could be a mental health center, we can kind of do our thing, and we could do this and that, but to reach out into the community, to be a part of what's going on, to really reach the people who need to be reached, the people who are the most vulnerable, the people who have the most needs, the people who are really aching to recovery and don't know quite how to go about that. We couldn't do that without our partnerships, and we like to focus on the big partnerships. We have lots of smaller partnerships that get us on down the road. So we try to list those here for you. It's not an exhausting list, but it's those that we can think of and report on. The Mobile Access Partnership will be 2 years old. It's one of our key partnerships in the community for reaching vulnerable people. It has to date served 1,270 distinct individuals, many of who are homeless and unsheltered. But I will tell you, the idea of mobile access, and we kind of started thinking, well, this would be a great way to serve the homeless, and we do serve a lot of people who are homeless, but we don't make people, provide any proof of residence or lack of proof of residence. If they walk up, they look like they're hurting and they need help, we help them. So just think of, a rolling continuum of care available to anybody who needs it. We have some people who, come and see us who just don't have anything going for them at all. They don't have a way to do laundry. They get very few, hot meals. They have any access to health care. So 1,270 distinct individuals through the Mobile Access Partnership. So going into we'll start its third year in May. It's probably that thing we do that warms our hearts more than anything, because it's got 4 or 5 agencies involved that literally take what they're doing in-house and move it out of house right to where the people are. Church parking lots. The Salvation Army the last 2 winters has been a tremendous partner, because we can't get all the vehicles out in the winter just because some of the water problems. They let us use their showers. They provide a meal at noon. So Shelley and the chaplain over there, the captain over there, have just been outstanding. And so we want to thank the Salvation Army as well. But such a unique program for our community that reaches out and touches people who otherwise probably wouldn't have access to care. I want to talk about the Shawnee County Intersection Coalition. This thing really took off about 2 years or so ago when you folks approved the resolution to become a stepping up county, and that led to our county being innovator status. So we're one of about a dozen or so counties in Kansas that, because of how we've taken all of our assets that we can, social, health, behavioral health, and focused on the criminal justice system, and how can we help folks in the jail? How can we keep folks out of jail? How can we follow them after they leave jail to provide services they may need? Shawnee County's really been on the map. A lot of counties ask us for leadership. Director Cole's just been outstanding in advising places like Great Bend, Emporia, and others. Commissioner.
Bill, all right, so by participating in the Stepping Up, by being an innovator county, how does that benefit Shawnee County? Does that open us up to other grant application possibilities? Does that open us up to funding? Does that open us up to, what's the gain?
We haven't received specific funding for it yet, but the state is very aware, KDAS is very aware of our work, Department of Corrections and others. It did help us garner some assets from Larned State Hospital here at the jail to help Director Cole, increase the number of competency to stand trial evaluations, and we were able to bring actual competency restoration work to the jail. Prior to that, anybody who was found to be not competent to stand trial had to go to Larned State Hospital to be restored to competency, which is generally a series of educational presentations and interactions with the individual to the point where they can understand the charges against them, et cetera, et cetera. And so we were able to bring that to the jail. And I'm pretty convinced that because Shawnee County was on the map with Douglas and Wyandotte and Johnson County, Sedgwick County, other leadership counties that have stepped up and really tried to make improvements in the whole of the criminal justice system, up and down the line, from prevention to incarceration to follow-up, that really got us on the map for that service. I do think there's grant and contract money coming where we can provide more restorations in the jail, so I think that's going to be an improvement. I think that as we continue to look at making improvements in the physical plant at the jail, for example, perhaps a mental health unit someday, which Vallejo fully supports. If we can add a process or a place or a piece to that, and Director Cole has spoken of it, kind of a reentry center, not reentry into the jail, but reentry into the community. If we can find a way to serve people on their way out of the correctional facility door, if there's a building or a place or a process where we can hook them up with all kinds of health and social and personal services, everything we can do to wrap protective factors around them as they re-enter the community, hopefully then they'll not re-offend. I'm hoping someday there'll be operational money for that, not only for the county, but for the mental health center and other providers who want to come in there. So imagine a mental health facility someday, or even the current facility that we have, if we can't build a facility, which I sure hope we can. But if we had a place and a process and a collaboration of providers, including Director Cole and his team, to work with people in as much as we can, if we have notice that they'll be leaving the jail, can we get with you for an hour or 2 or 3 hours? Can we prepare you for reentry into the community and try to increase your chances of success? I think there'd be money for operations for, social staff, healthcare staff, caseworkers, care coordinators, people like that to interact with individuals. We want to arm people with as many protective factors as we can, socially, healthcare-wise, family-wise, help them find housing, before they just kind of walk out of the jail. And there's a lot of that work that goes on now, but I think we can ramp it up and get it funded in the future. So there's hope there, Commissioner. So far, not tons of grant money though, but tons of recognition, getting ourselves in place for that day when I think the river is going to flow, so to speak. Chairman?
This program you have where you evaluate someone for their competency to stand trial, is that, then I assume that speeds up the whole trial process and also probably reduces time people are sitting in jail waiting?
Yeah, it has. In the pilot that Larned State Hospital staff, actually, the director of the program actually came up here and did that work over a series of months. And we did prevent some people. I say we, I mean us all working together. Vallejo didn't really have a hand in that. We just, chaired the meetings and facilitated the meetings and helped the process and got the right people together and looked at the forms and the laws and things like that. But yeah, we were able to, actually do some of that restoration work here. A psychiatrist has been doing the competency stand evaluations for quite some time, does a great job, but because of bed shortages at both state hospitals, folks would find themselves waiting in jail to either be evaluated or to go through the restoration process if they were found to be not competent to stand trial. So by bringing the restoration services, which restoration can happen in some cases at, just a short period of time. Other times it, takes longer. But by bringing that here to Topeka, at least in the pilot study, we found we were able to shorten some jail time, speed up the, the wheels of justice, so to speak. So I'm hoping we could do that on a larger scale in the future, and that's going to take some additional staffing. So whether Vallejo provides that service or somebody else, the real issue is, can we get in there and help move along the process, get people out of jail quicker and on through the wheels of justice, or wherever they may go after their trial.
You said it's a pilot program.
Pilot program, right, yeah. It wasn't a wholesale, brand new program, but Larned staff did come up. I think they were in here a couple days a week, actually working with people and restoring them to competency, and several were, which meant they didn't have to go to Larned. So the point of all that is, Chairman, we know we can do it locally. Other counties are looking at doing it as well. Director Cole's in a position to advise those other counties on, some of the forms, some of the court orders you need. Worked with the court on, and Larned actually provided us the actual forms they use to, get certain motions in place so that this work can occur locally versus at the state hospital. So it was just a pilot project, but I do anticipate, back to Commissioner Cook's question, that there'll be some funding someday for 1 or 2 or 3 full-time people to do that work here in Shawnee County, and who knows how many lives we can touch with that. Quite a few, I would think. So.
One other question. If someone's proven to be incompetent to stand trial, where do they go then?
Well, normally they would go to Larned State Hospital to have that restoration take place. What has delayed that, like with a lot of us, there are hiring difficulties. So the state hospital's just not been able to fill some beds because they just can't fill some open positions. So that backs things up on every county, large or small. So once a person needs restoration to competency, let's just say they go to Larned State Hospital. That can take a few days, a few weeks, a few months. One of the roadblocks to competency restoration is medication. Some individuals are willing to take that medication that helps reduce their symptoms of mental illness so that they can be declared competent. Other individuals just refuse that medicine. So there are actual court orders that can be enacted at the state hospital or at a jail. We're not there yet, but it could be done at a jail where a person is compelled to take medications over their objection. Then once those medications take effect, those rational cognitive processes step in, kick in, then we can restore the individual to competency. So it sometimes, Commissioner, gets down to whether or not we have to compel a person to take medication. And right now, the only place to do that is at the state hospital. It can be done here. We have the processes in place. We're having meetings about it now. There are certain court orders you have to have in place. So the district court and others are aware of what we need to do. So I think we're on the cusp of being able to do it. And so I think someday we'll do quite a bit of that work here. But yeah, medication, taking medication to deal with the symptoms of this, usually a psychotic process that's blocking rational decision-making, which of course then means you really can't be competent. And then if we can restore that, then folks can get on to trial. So I hope I answered your question with that. So I think, we're on the verge of some really big stuff, and I think that one of the most productive things we'll do in the future is help people as they're preparing to leave the jail. Of course, sometimes, and the director will tell you this, sometimes they find out in an hour somebody's leaving. So what can we muster together to help somebody in an hour? But if we have, a few hours, a few days' notice, I think we can do more work in the future preparing people for jail release. So a lot of that would have to do with the Intersection Coalition. We've worked on that. We've worked on some other things. But that's just we've been doing that for, I think that group's been meeting a couple of years now. Got all the, right agencies and departments involved in that, just how we can improve the criminal justice system as it relates to mental health and addictions. There's a list of our services there in 2022. Spend some time on page 2 and 3 talking about our emphasis on public safety. We think that's, at least for Vallejo, one of the key things that we do is join with other agencies and focus on public safety. We're trying to, be available for people who are suicidal, people in deep crisis, people who are unsheltered, people who are victims of one kind of, life circumstance or another. So then we talk about the several ways that we do that. At the measurable outcomes that we have to date, these are starting to improve. We've hired additional data analysts and been able to gather up and look at more data, Commissioner.
Bill, can we talk a little bit about the homeless outreach team? Homelessness, unsheltered in Shawnee County has really moved to the forefront, and I know that there have been a couple of different large group meetings in the community. The community is just talking on several fronts. What can we do as to the unsheltered and the homeless? So what's Vallejo doing as to the homeless and unsheltered?
So a lot of great conversations out there. The city and the county, I think, are both, stepping up and becoming, a really active leadership there. What Vallejo does is we team up with the Topeka Police Department and Rescue Mission. We've got the city divided into 8 sectors where we know that individuals live who are homeless. The actual unsheltered homeless. There are quite a few people that we would call homeless who don't have an address. They're staying with somebody for a few days. They're kind of in and out. Maybe they have, a camper they're living in or a car, and they've got some kind of shelter, but they're unsheltered. So we know where the unsheltered folks are living, and they do move from time to time, and we try to track them and follow them and provide services to them. So I know the Vallejo Homeless Outreach Team is out 2 or 3 days a week, in addition to MAP, visiting with people one-on-one, making sure they have supplies, that kind of thing. We're able to get them into treatment if they need it and help them with other needs they may have. So that's probably our main effort through the Homeless Outreach Team, and then making sure we have residential programs where people can go and live. We do a lot of work with housing vouchers, helping people obtain city and state housing vouchers so that they can get their own place and have a home, and if they need to, begin to recover. That's kind of a nutshell what we're doing there. I'm just trying to get out ahead of that, we spend a lot of time preventing homelessness. We have people who maybe come out of the state hospital, they don't really have a place to go, so part of their discharge from the state hospital will be having a voucher lined up for some rental assistance. Even if they can't get that, we work with landlords who take people, give them a place to live, and use their whatever support dollars they can get to pay their rent, groceries, and food. We have client emergency fund we can use for people who might need a little bit of help getting up on their feet, clothing, things like that, food, some household supplies, those kind of supplies. So we spend a lot of time every day trying to prevent homelessness. and just, help people find jobs so they can pay rent, things like that. So that's kind of a quick summary, though, of our homelessness effort. A lot of work being done in that area. It's kind of one of our main things. We figure that if our mission is to be available to people and reach out and make sure people know we're there, people who have the least capacity to gain help, if we can reach those folks, then we can reach everybody else. So we try to tackle the hard job first. So it's, the data there, you can read through that, some of the outcomes there. And then just a quick comment on CCBHC. We think we're close. We hope we're close, hopefully this summer. But the end of my report just shows you a quick listing of CCBHC services. And some of those are what we provide now. Others will be fairly new, but I think we'll be stronger and better going forward. That will conclude my report. Commissioners, if you have questions, my time is yours.
Any questions?
Bill, we've talked before about becoming a certified community behavioral health clinic and how that will maybe change the look and the feel and at least the finances of Vallejo. So where do you see that going?
Well, hopefully in July we can be certified to be a CCBHC. Medicaid will pay at cost, and that should increase access. So, our goal is that anybody who walks in, 100% of the time gets services on the day they walk in. I'm talking about, routine walk-in. So just one example. Right now, if a person comes into Vallejo today for just a routine, like, hey, I need some help kind of a problem, we see a little bit better than 90% of those people the same day. If we can't get to them, they're asked to come back the next day. Of course, you know that during crisis, we pretty much drop everything and get right to that person. That's close to 100%. But our goal is that everybody who walks in on a single day at least gets their first service that day. I think what you'll find as a big improvement with being a CCBHC is that we're able to track and follow. That kind of maybe sounds kind of bad, we track people and follow them around, but it really boils down to what's called care coordination, health coordination, client engagement, any of those kind of things. So it's not uncommon for a person to come in crisis, they come and see us a couple, 3 times, and then we schedule them, we have a program built up just for them, and then they may not follow through for whatever reason. And sometimes they get some immediate relief from their problem. They think, okay, I'm better for a while, and then it lasts a few weeks or a few months, and maybe they break down again and come back. So one of the improvements you're going to see is that we will stay after people. We probably will become pests and, call people, email them, text them, knock on their door if we have to, and just say, hey, is there, we're here for you. We noticed you haven't been in for a while, that kind of thing. So I think our capacity to engage people, to really stay after people, that once they said they want some help, to follow on through. And if you think back on other presentations, and I know you guys know this from your work, but and other exposures you've had, but mental illness is a disease of motivation and emotion. And so on a given day, you're ready to go, you're ready to recover, and then that you get going with your program, and then maybe that disease kicks in even harder in a few weeks, and all of a sudden your motivation to get better is just gone. So when you start to hit a low point, we want to be there and help bring you back. We'll do that through phone calls, emails, texts, personal visits. There will be a kind of a centralized individual for everyone who comes in who's responsible for following that person around. I know it sounds kind of bad if you think about a mental health center following somebody around, but that's what we intend to do, is just try to engage, re-engage. What we don't want, somebody comes in June and they go through a 3-day stay at the crisis center, they get back up on their feet, they get to feeling better, and we don't hear from them again for 6 or 8 months, and they break on down, and maybe there's a suicide attempt. We want to engage that person over those 5 or 6 months to try to prevent any further decline in their condition. So you're going to see us stay after people even more than we do now, Commissioner. Of course, that's all voluntary. People just tell us that, go away, but we'll have the staff and the capacity to be more persistent. We do a pretty good job now prescribing quickly. Once you get your first visit set up and it's decided that you need medication, we can get a counselor and medication on board generally within a couple of weeks. I'd like to see that within a few days. I think we're going to be able to get there someday. So that'd be even a quicker process. So those kind of in a nutshell, I think what you'll see out of Vallejo is quicker, more longevity of care. I think you'll see less turnover in clientele and people sticking with their program, completing their plan of treatment. Hopefully, we can expand alcohol and drug abuse services. We need some more physical space for that and always need more staff for that. So I think that's another improvement you'll see out of Vallejo in the next year or two. Fingers crossed.
The last question I have is, in 2013, the budget for most of the departments was cut between 5 and 10%, Vallejo included. And then over the last several years, we've been adding back to that to get us back to where we were. So in last year, the county commission increased that budget for Vallejo.
Yeah, much gratitude. Thank you.
When we do something like that, are we making forward progress on mental health in Shawnee County, or are we just keeping the programs that we already have because of inflation, rate of increase of wages? Are we just basically staying level with that increased funding? Because on its face, it looks like Shawnee County is stepping up with funding, but if you're getting hit with rates of inflation and wages, you're just staying on level.
And that's always the dilemma. The cash last year, I know at least for Vallejo, and I'm pretty sure, and I know Kathy can comment on that, but it went right to the bottom line. And we use that actually to increase pay for people and try to give some year-end one-time pay adjustments just to kind of help plug the leak in staff leaving and to attract staff and just reward our staff for the hard work they did. So we put that cash right to use. Then that's always the dilemma, I think, for any level of government is when do we put money in? Do we wait till things get really bad and then put money in, or do we put money in every year? I mean, as a mental health director, if everybody we dealt with in terms of funding and support and supplies and all that just plugged in, I mean, make up a number. What's inflation every year? 1%, 3%, kind of depends. Right now it's higher than that. But if our funding was tagged to inflation, year after year, we could build that up little by little and keep pace with what's going on in the financial world. We wouldn't have to come in and ask for large increases every 4, 5, or 6 years. So I don't know if that gets at your question, but every dollar you give us goes right to the uninsured, which is our most costly area. It goes right to staff. It gets put to use, when it's given. So, of course, my nirvana is between, now and in perpetuity, and I know that you can't really budget this way, but if funding went up 3 or 4, 5, 6% every year, or was at least tagged to inflation, then I think, we'd be keeping pace a little bit better. As it has turned out the last 3 or 4 years, there've been additional dollars. We've tried to put those to use in specific places, and you've made that effort. It's much, much appreciated. A more pro forma pattern of increases would be kind of an administrator's dream. So, but not always a reality with the way things go, because you all have a budget to meet as well. So,
All right, thank you.
Bill, your community-based mental health care for veterans, is that something that supplements what they do, or is that in addition?
It supplements it. One of the closest ways we connect with the VA is serving individuals who are homeless, who are veterans. That's another area where we will make some improvements. We'll be able to increase capacity to provide services to veterans or to coordinate with the VA. So that relationship is developing. It's not quite where we want it to be because we've all been just so busy and short of help, but we're starting to track the number of military veterans and military service people and their families who come in. One of the requirements of being a CCBAC is that you do that. You do more of that, and you do it better. So I think we'll be serving more people who are in the military or who have been and their families, and hopefully I'm pretty sure we'll have the funding to do that. But the VA will be one of our biggest coordinating partners there. So that relationship's coming along. It's not where we want it to be. And I'm not trying to point fingers or find fault. It's just that time is a problem and staffing is a problem. So
didn't they announce the other day they were going to add a new facility for housing of veterans? Or
I have to check on that. I was
don't
off for a few
remember the
days last
details,
week,
but-
Commissioner, in Oklahoma, and didn't really. Tried to stay and plug best I could, but I think there are some some new plans. I know that, one of the priorities for the Veterans Administration has been to reduce suicide, homelessness, and increase crisis intervention, for their covered lives. And in as much as we can be, we're going to be a part of that. But I think you'll see us serving more veterans as we go. That I failed to pull that data up. I meant to and just didn't. I just forgot to do it. But we are starting to count and track and do a better job with that. So,
Anything else? Thank you, Bill.
thanks. Sir.
Thanks for everything you do out there.
Appreciate you.
All right. Kathy Mosier, you're up.
Come on down.
Well, I want to thank Bill for being such a great community partner and collaborator. That's kind of my style as well, and to come in and have Bill already doing such great work with the community, and now we get to do this together to do the whole lifespan from, birth to aged. So that's very exciting for me. This first brochure that I gave you, rather than list, we have so many services, rather than list them all, what you'll find in here, we kind of categorized them into groups of our categories, but we have lots more services that go into those categories. And then it's also a Hispanic version as well. But what I'll focus on in the beginning is our annual report for Family Service and Guidance Center. And this will be based on 2022 data, and then work into kind of those overall system kind of issues. So I'll first bring your attention to the colorful one for our annual report and take you to page 4. These are some of the highlights for 2022 accomplishments. The crisis services prevented the need for psychiatric hospitalization for youth 75% of the time. This is well above the state average. You don't see this across the state. So I'm very proud of the crisis service staff that we have and the hard work that they do. Family Service and Guidance Center added substance use treatment program. We became licensed as an agency to add that for youth. So we now do mental health and substance abuse, so the full behavioral health spectrum. And we have a tobacco cessation specialist for things like vaping and smoking addiction for our youth. Our popular Happy Bear program prevents abuse by going into all the elementary schools and providing education on sexual abuse and all abuse. And we helped nearly 6,000 children during 155 presentations this year in Shawnee County. We had 4,000 teachers and school staff who received outreach materials and information about how our programs can help their students, to help them be that bridge for us to kind of extend our arm out into the community further, to help keep kids who are falling through the cracks, who weren't reaching our services, to be able to get to us. We had important discussions with area high school students. We have a program called Suicide, Talk About It, and Save a Life. This is led by high school students who gather together and talk about what they know and what they see, because we know that they are likely to text each other and to talk to each other about this, but not talk to a grown-up or a professional or a parent about the feelings that they're having. And so this is a way for them to start being proactive and knowing that if they're faced with a friend who's struggling, things that they can do to help. We added 3 new mental health first aid instructors who are available to educate our community. A lot of times it's just that you see someone struggling and you don't know how to have that awkward conversation. So having a little bit of information is power, and then being able to know how to address that conversation and knowing that you're not going to make it worse. Statistics say that even flat out asking someone if they're feeling like committing suicide, that is better than not asking anything at all. And so we know that saying something is better. Our Diversity, Equity, and Inclusion Committee participated in the Racial Equity Collaborative Symposium at the University of Kansas, and they provided then valuable training to all of our FSGC staff on cultural bias and helping us to be more sensitive to those issues so that we can serve all members of our community effectively. In post-COVID efforts to rebuild our staff, we partnered with area universities to a further extent than we ever have. We offered 15 internships this year, that broke a record, and staff wellness events for self-care breaks, because during COVID and post-COVID, all of our healthcare staff are pretty exhausted and burn out. So whether you're a nurse or in the hospital system or in behavioral health, we were all affected by that. So then in looking at the numbers, unduplicated clients were in direct services were 4,000, over 4,000 kids that we saw and families. 259 staff members are how many we have had in 2022, and that need has grown for our services, and we continually get more demand on our resources, and so that number has gone up since then, and I anticipate that will continue to go up. 71% of our clients and families who live near or at the poverty line. And we see about 6 new clients a day, 6 new youth a day coming in saying, we don't know what to do, we need help. If you go to page 7, it'll
Okay.
talk about our financials.
Kathy, before we go there,
Yeah,
33 counties were served by Family Service and Guidance Center.
uh-huh.
How does that, I would have thought that the state would have been broken out more into regions and more specialized, you group 3 or 4 counties together for local facilities. So how does that reflect? I
Yeah,
mean,
that's a little misleading. We serve Shawnee County. What happens is there are transient folks traveling throughout the state who end up in crisis. So it is our crisis services that end up serving the 33. So if somebody's coming here visiting grandma and they have a mental health crisis while they're here, and they come in, or they end up in the hospital at the ER, or they end up in our crisis services needing stabilization.
Now,
That's where that number comes from.
do I understand correctly that Family Service and Guidance has one of the few alcohol inpatient treatment facilities for adolescents? Is that
Not yet.
not yet? You're
Not
working
yet.
on that. All right.
We're doing outpatient now, but we're trying to get our crisis house revved up to have a substance use unit with beds to actually help people with the full recovery.
Okay.
Yeah.
Kathy, how young are some of these people? What are we talking about?
Usually teenagers, but we have had some as young as 11.
And that's for the outpatient alcohol program, or is that what you're?
Alcohol.
Yeah.
Substance abuse in general, or
Yeah, it could be alcohol, it's any addiction, really. So it could be from tobacco to alcohol to meth to, young people are getting their hands on pills. But a lot of times marijuana now gets laced with fentanyl, things like that, has never been the case before. And you can't regulate that. When it peels off, flakes off, falls off, then you're at the bottom of your bag and then you roll a joint. What happens is you're getting more fentanyl than you realized, and you have serious overdoses. But we're also finding that kids are getting into their parents' stashes or friends, family, whatever, that might have gummies or edibles or things that they think are candy, and they taste good, and they don't realize what they're doing. And large amounts can even cause hallucinations, and people are ending up in the ER with very serious health issues because of that. It's not something that's always been well known about marijuana being able to be that serious, but at those high levels it can be.
So are you seeing a trend, an upward trend or down, or downward trend on abuse, or?
Upward trend on substance, absolutely. Yeah, now that fentanyl's hitting Kansas, and opioids. And that's going to drive crime, homelessness, theft, lots of things in our community. Okay, so turning to the financials, in 2022, our cost to provide uncompensated care was $2.8 million. After the state and county funding, we were in a deficit of nearly $1 million. So our expenses went up, our revenue did not keep pace. And we had a deficit this year, or last year, for 2022. And to clarify the funding, there was funding to be added to the Community Mental Health Center safety net, but then it was retracted out of the budget last year and put into Spark one-time funding. So we did have an increase through one-time funding, but it's stayed flat in terms of for continued years, just as a reminder. We can't retain staff when we can't offer compensation that's competitive, and that's one of the biggest things that we are striving for right now.
If I can stop you right there.
Yeah.
I know that that's a reoccurring statement across all sectors, is trying to retain staff. But where do you see your competition coming from? Is it the private sector? Is it going to work for other state agencies? Is it moving out of state, out of county? What are you seeing?
So because of the rising need, there was a mental health crisis brewing prior to COVID. COVID had a huge impact on mental health. So especially anxiety, depression, skyrocketed, whether you had a proponent for that or whether you've never had it in your life and you saw it for the first time. And so we're still dealing with that aftermath. And then on top of that, you have the rise of more opioid and fentanyl use. And so between all of those things and national attention to mental health, seeing that as a root cause, or a root solution, really, what's happening is that everyone needs mental health. The schools need mental health services. The hospitals need more social workers. We need more social workers. But in addition to that, because of the underfunded mental health system, we're losing people now to states that became CCBHCs before us. So Nebraska, Missouri, Oklahoma, Colorado, they expanded Medicaid. Missouri is CCBHC across their state. They were an early demonstration state. So we're losing them out of state. So that's the biggest concern that I would say that we have in Kansas, is that we're losing them out of the state now. And that's a real concern. We need to be able to keep our people here.
Okay, thank you.
Our school services. So one of the things we're trying to do is operate outside of our four walls, go where the issues are, and help people earlier. We know that if we get to them earlier, before it becomes so severe, it is less. We can get them healthier and in recovery faster, which means it doesn't cost as much to our healthcare system. And also, if we can attend to them at the time they need us. So at the time they decide, I have a problem, the sooner we can get them in, the more engaged they are, which means the more they work at it and the higher the success rate. So given those kinds of things, we need to be able to be nimble to operate where the need is as quickly as possible. And that's one of the reasons why we're moving into the schools to catch the kids who aren't making it through our doors for whatever reason. So the idea is that we work with the high-risk, high-need students in Topeka schools who could benefit from mental health but can't get to our offices. And they receive individual therapy, case management, and then we wrap them with all of our other supports and services as they need it. And this program grew tremendously in 2022 after the year before, that it was seen as such a success among the school staff. So we went from 4 school-based clinicians to 9 in 2022. We reached 371 more children and teens that were not already engaged in services by being in the schools. And the students with attendance issues that we served in our program had a 58% improvement. The problematic behaviors improved by 69%. The school keeps track of these stats, not us. These are their stats that they tell us how we're doing. Academic performance improved by 58%. So 4 schools were added in 2023, and we have lots more hoping to get added in next fall. So 3 schools also added social emotional skill building services in groups. These are groups. There's a total of 9 of them across our community now. 300 children benefited from those services alone. Those help children learn how to self-regulate their emotions. Jaden is a story that's you'll see on page 9. He was struggling as a freshman in high school, adjusting to high school, so much that he was failing every class, and he was acting out aggressively towards others on several occasions. Within 9 weeks of school starting, he was suspended, and Jaden is not his real name, by the way. But he ended up being expelled for the year. So he made his way to FSGC a few days later and reconnected with a therapist that he knew from when he was in middle school. He said, "I don't want to go to jail. I've made mistakes. I'm going to keep making mistakes. I don't know why my brain works this way, but I know it's the only way to stay out of jail." And he enrolled with our team. We partnered with the school system, and he was enrolled in an alternative high school. We placed services in that setting and engaged him in therapy, case management, one-on-one support, self-regulation, all those kinds of things. And it's paying off. So he is now a straight A student in the alternative school. And we went from seeing him multiple times a week just to get him stabilized, and now he's having therapy and seeing his case manager every other week. So he's feeling much better. He's developing confidence. As you know, that success builds upon success. When you start having success, it builds success. And that's what Jaden's getting to experience now. He rarely becomes aggressive anymore, thanks to the strategies that he's learned through his service team. And he's already looking toward a brighter future with having future goals in mind, which is new for him. So we're really proud of that. A couple other comments that I'll just make are about the value that we put on community partnerships with family practice doctors, with pediatricians, putting our services in the schools, Stormont, Grace Med, KU, St. Francis, Vallejo. We've added integrated care to help our families navigate all the systems of care that they have to deal with. If there's a physical health issue and a mental health issue or a behavioral health issue, it gets hard to navigate those, especially when you're in chaos and it's harder to think, when your family's in crisis. So mom's worried about losing her job, school's not going well, all the things that make it hard to be at your full potential as a parent. So that's part of the care coordination that Bill does at his shop and we do at our shop. And now our folks are coordinating together as well as they go through their transition age from one to the other. And in 2022, the state funded us at 12% and the county funded us at 4%. So we're fighting to get the staff that we need every day, and we don't have enough funding to recruit and retain staff anymore. There's going to be times that we're getting to a point with our deficit and not being able to increase, that people won't be able to access the help they need. So in terms of one of your questions before, yes, we're trying to keep our head above water with inflation and rising labor costs. That's huge for us. And we hope that you can help us close the gap along with the CCBHC model. And we need both. So what the CCBHC model does funding-wise is it's going to help us with our Medicaid and to provide more adequate at-cost service. But what we still need help with is our uninsured, and we still need help with things that CCBHC isn't going to finance. So the prevention types of activities, mental health first aid training, suicide assistance, prevention training, community relations, and marketing and education. So those are the kinds of things that are kind of carved out of the CCBHC model. And the CCBHC model also comes with, if we're going to give you this extra money, you have to do this. Now, we're excited about this because what it's going to do is it's going to help us be able to bring in the best practices and not be behind in bringing in the best and greatest practices in mental health to help people get healthier faster. So we're going to get better outcomes. And like Bill was alluding to too, was it's going to require us to have a more robust data system so that we can make better data-driven decisions, more population health tracking, so that we know and we have a continuous improvement plan to consistently show that our outcomes are moving up in the right direction. So that's paying for basically proven best practices to bring in and make sure that, and requires us to use those. That is something we've always needed funded, so that is something the CCBHC can help. As always, we still need your help with the safety net and the uninsured and taking care of those costs. And then in the mental health first aid training and getting the word out there to help. A great extension of us is our community being informed of how to address mental health when they see it. Because if they can start those conversations, people get connected faster, they get healthy faster, they don't need services for as long. That's all cost savings. And then the last thing I'll mention is what makes us a little different. I get asked this a lot, so what's different about Vallejo and Family Service and Guidance as a community mental health center than other providers? We're a nonprofit, first of all, which means that any revenue that we do get is reinvested to develop programs to meet the needs of our community. So an example would be our school-based services, our 24-hour crisis, addressing crisis 24/7 youth addiction facility coming soon. We offer a much more comprehensive range of services and supports that we can wrap around folks to get better outcomes, like respite, to give parents a break when they have a very high needs kids that they're working with, and they need to take care of themselves every once in a while so that they can operate at their full potential as parents. Emotional self-regulation, teaching those skills, one-on-one out in the community, in the homes, where the kids eat, live, and breathe. It might be how to help them go introduce themselves at the park and make a friend. All these kinds of skills in the community and in the homes are very important. And we do a lot of that in our center over the summer to get them ready for a more successful school year come fall. And you can depend on us. We get more frequent audits, we get more frequent site visits. There's a lot that goes along with being a community mental health center and being licensed. So you can rest assured that we have eyes on us every step of the way. that we're expending funding the right way and getting the results that we should. And then finally, we're directed by boards that are voluntary, but they represent the community that we serve. So this helps us stay in tune with what our community needs and stay accountable to the people that we serve. So sometimes that seems to help people understand what the difference is between us and then other private providers and things like that in the community.
A lot of the issues with these kids can be probably directly related to them staying home during that COVID period where they didn't socially interact with other people. They probably weren't getting the education that we hoped they would get. Do you see that now turning around where these kids are doing better? I mean, or how long will it take to turn that wagon around?
We have a whole generation that has been affected. It's going to take some time. One of the things is adults and kids alike lost their coping mechanisms, so their access to gyms, to their sports events, to, all those things are such healthy outlets for stress and anxiety, and even grieving people who died and not being able to grieve properly. So these are residual effects. And it changed. Change is hard, whether it's good change or bad change. Change is just hard. And the amount of change that our nation, our community went through, from work schedules to who you supervise, to working from home, to needing different resources, to doing things differently. In every aspect of our lives, we are having to do things differently. So it takes its toll.
Yeah, I think we handled it poorly, sending kids home, and, to a group of people who really weren't affected much by COVID. And I just feel like the collateral damage that was caused to all these kids for a whole generation, maybe, kids who don't recognize facial cues and things like that. I hope we learned a lot.
Yeah,
from
I
this.
think it's a lot to learn from.
A lot of collateral damage from
Yeah.
this, and hopefully in the future we learn from this. All right.
Yeah, yeah.
Yes.
So Kathy, how do most kids end up in your services? Is it self-referred? Are they forced to go by family members? Are they, at a point where they know that they need help and they're just, the school sends them? Or, how do most kids end up?
Our two biggest referral sources are parents and, three. Parents, youth themselves, and schools. We also have juvenile corrections. We have the whole community. But what we're finding, because we're in the schools now, is that we're really breaking down stigma. It's and the kids have no issue with it or talking about it once we get in there. The adults come in behind that and see that. For instance, kids going through the hall saying, hey, you should go see Miss Tammy. She could really help you. And the teachers are starting to hear this in the hallway. So they're in case conference meetings or IEP meetings or different things that they're doing, and all of a sudden these issues, it's okay to talk about. And so we're getting better at getting people connected sooner. So those school resources have really been successful at getting them connected earlier and seeing things sooner. And now we're trying to work on teens helping teens, because what do you do when your friend says, I just want to die. I broke up with my boyfriend. I just, there's nothing left for me. What's a teenager supposed to do with that? What we know they're not doing is they're not ratting them out in their terms to their parents. And so if that's not happening, how are they getting connected? They're not. They're just going and going and going. And we know that when youth help youth, If they're not educated, that can go one of two ways. That can be very helpful. They can, they can be a good friend and be helpful, or who knows what advice they might give them about how to handle that, or say, here's a pill, try this. And so try in an effort to try to help them out. So what we want to do now is get teens educated to help teens, and college students educated to help college students. And if mental health can become an extension beyond us into our communities to be able to have the knowledge of how to help people, we're going to get a lot better faster. And part of CCBHC helps us build those connections and partnerships. But again, I'll say Bill's already done a marvelous job of that in our community, and we're off to a head start, I think, in Shawnee County.
And would you say that, I know that historically speaking, there's been a stigma attached to mental health. People don't want to admit that there's a problem, or for fear of, publicly people seeing it. Would you say that that stigma is kind of going away with the younger generation? Is that what you're saying?
Yes, it's still there for sure, but absolutely the college kids, high school, and high school and elementary in particular, having more of these resources, where this is a state effort for community mental health centers to put services into the schools. And the reason we're doing that, the schools would like 400 social workers, but we need 400 social workers, and there just aren't that many. So we have to work together to say, let's use our resources as the most effectively that we can. And since we already have, rather than one social worker in a school who has one set of skills, when schools partner with the community mental health center, they get the whole backing of all of our therapists. So when one therapist encounters a specific, maybe a more rare diagnosis or mental illness, they can say, hey, can anyone help me with this? And we all help each other, and we have a huge breadth of resources. In addition to that, community mental health centers get along really well across the state. We all have different trainers. We all use each other's trainers. We all help each other be successful. And so that's been a very powerful, I think Kansas has one of the most powerful public mental health systems that exists.
That's good to hear. Do you ever have situations where maybe a child or a school knows that they need to seek out services, and parents are unwilling to admit that there's a problem, or say that, don't treat my kid, or
Yes.
that kind of thing?
Yes.
What do you guys do for situations like that?
Well, that's one of the beautiful outcomes of moving into the schools, where parents may refuse or may not be able to leave work to get them to us, or just flat out has a stigma that they don't want. If they're in school and they need something, and the school is helping to connect, the school saying, hey, your child's having problems in the classroom and we need to work on this, they're much more apt to gradually go down that route. And then once they see the benefits of it, then they usually are, oh, wow, we should have done this a long time ago.
Great, thank you.
Well, thank you, Kathy.
Thank you. Thank you for all you do.
Thank you for all you do. Next on the agenda is public comment. I don't see anyone here. Administrative communications. Kurt.
Good morning, Commissioners. Since we're not going to have a Thursday commission meeting, I thought I would get up early and say that beginning either Monday, May 1st or Monday, May 8th, we don't know exactly which day yet, contractor will be closing Northwest 66 between Topeka Boulevard and Indian Creek Road for a bridge replacement project. This is the project that KDOT has let for us. Calendar completion date is October 6th of '23. Local access will be provided off of Indian Creek Road. Thank you.
Thank you very much. Mr. Mays, you have anything to add?
No.
Oh, I'm sorry. Nelson.
Morning, Commissioners. Nelson Castile, Ambulance Compliance Officer. Just announcing that the nurse navigation pilot program that you approved a couple weeks ago will be kicking off tomorrow at 9 a.m. We've brought together a large group of folks to work on this, and I think that we're going to see some results. We'll be up here on a regular basis to provide you with an update. I was also informed by AMR that they believe they're going to be in front of the City Council to provide a presentation on nurse navigation on May 2nd. Would probably be at the Holiday Building, or you can watch it on their YouTube or live stream, whatever that is. I would stand for any questions you might have.
Thank you.
Thank you, Commissioners.
All right, Commissioner Mays, anything to add?
Bill, no meeting Thursday. My understanding is you and I are both going to be at the Kansas County Commissioners Association Annual Conference, so be back next week.
Nothing to add.
I have nothing to add. Did a little volunteer work this week, a couple nights at Old Prairie Town for tulips at twilight, and put in bricks yesterday at Gage Park Memorial, so.
Did you stop by the cornhole tournament?
I did not, did you?
I did. It was
Wow.
actually pretty cool to watch. I was there for the live ESPN2 broadcast, and it was standing room only, so I think we looked pretty good on TV.
And I think Kellen said there was 87 lanes that they had set up.
It was massive.
That's a lot.
And so my family and I did the fun game where we go through the parking lot, count license tags, and we counted 16 different states in the parking lot. So overall, a good event for Shawnee County.
As when I was doing tour work at Tulips at Twilight, I would ask people if they were from Topeka. I would say 80% were from outside Topeka.
Wow.
So we were drawing a lot of people in, which is good. So, anything else?
No.
You know, I think we're adjourned. Thank you.